Hello, everybody. My name is CMR Hemdinger, and I'm going to be talking about type 1 diabetes. Before you start, I want to ask all you guys, what is type 1 diabetes? Anybody know? Anybody? Take a guess. Anybody know? Okay. Well, we're going to be talking about what that is. So before we start, I'm going to tell you a story about my daughter. She's a type 1 diabetic. We didn't know that she was a type 1 diabetic. That day, she had a shake from McDonald's. She was a little grouchy when she came back, and I was like, okay. Didn't think anything of it. That night, she was losing a lot of weight. She was going to the bathroom a lot, and I was like, what's going on? Like, this is not her to be losing weight. It was 2:30 in the morning, and I'm like, okay, something's not right. Took her to the hospital. She didn't get seen right away. It took a while for her to get seen. I was kind of worried that she was going to make it that night because we didn't get seen like we were supposed to. Doctor came in. He says, your daughter has type 1 diabetes. I said, oh, but we can't admit her here. And I said, why? I said, because Banner does not have any beds for her. So I said, okay, well, let's go. They told us, well, we're going to rush her to Phoenix Children's Hospital in an ambulance. So we went there, and they went ahead and told her she didn't have any water. She had DKA, which is diabetes ketoacidosis, which I will explain later once we get to the presentation. So she was in the hospital for like almost a week. They taught us how to do her insulin, do carb counting, everything that we needed to know to take care of her. Once we figured all that out, we were golden. We first went on the files, and we went on the pen, and then we went to the pump. And so now it's been a challenge, but we got through it. So that is my story about that. So let's get to this presentation. So the facts, interesting facts about this place, about diabetes, is that type 1 diabetes accounted for roughly 10% of almost 4 million global studies of diabetes. People with type 1s are insulin dependent for life. What is type 1 diabetes? Is it incurable autoimmune disease, not a lifestyle disease? It's when the pancreas isn't working properly and it does not produce any insulin. Type 1, what causes it? It is an autoimmune disease reaction. The body attacks itself by mistake. That destroys the cells in the pancreas, making insulin called beta cells. This process can go on for months or years before symptoms appear. Activity time. Work with a partner, and I want you to brainstorm the causes of diabetes. Share with your partner in about 10 or 15 minutes. Okay. Any ideas? No? Okay. All right. Now we're going to talk about the symptoms of type 1 diabetes. Increased thirst, frequent urination, excessive hunger, bedwetting, untainted weight loss, irritability and mood swings, fatigue, and blurred vision. Well, my daughter only had the intended weight loss and extreme thirst. Other than that, I don't know about the other ones. Okay. What are the health risks of type 1 diabetes? Well, health risks would be heart and blood vessel disease, nerve damage, kidney damage, and eye damage. What are the health risks? Other health risks would be hyperglycemia, which is like, crazy hyper. That's the high blood sugars. Hypo is when you're low blood sugars. You have low blood sugars. You get too much insulin that you cover for your foods, your carbs. We got the glucagon kit that we're going to talk about. The glucagon kit is when you have severe low blood sugars. No matter what you do with the carbs or coverage, your sugar doesn't go up. So we do this so we don't get in the danger zone. And we use it so we can get those blood sugar numbers go to their target range. So we're going to do an activity today about the glucagon kit. So we got this bear named JD. He is my diabetic bear. And he stands for, the reason why I named him JD is because juvenile diabetes. We're going to use him as our guinea pig to show you how to use one if you ever had to use one. So here is a glucagon kit that I have. You got to make sure the date is not expired, but we're only demonstrating, so it doesn't matter right now with the date. But you got your little powder stuff, your needles right here. You're gonna follow the instructions and do what needs to be done. You're gonna have alcohol wipes, stuff like that. You're gonna put this in here, shake up the powder, and once you do that, you're gonna get a syringe and you're gonna drop how much you need, and it goes by the age. So little JD over here is 12. So you're gonna draw up 12 units of insulin. And then you're not gonna cover or do anything once you use that. So you're gonna, I'll pass this around and you guys can, experiment, do what you need to do. Okay, so you guys know what to do if you ever had to use one, okay? All right. And these are just a couple more slides of different ones, different steps on how to do it, okay? Now we're going to talk about DKA, which is diabetes ketoacidosis. My daughter had that. Basically, it's when your blood sugar gets so high that you get acid, which is ketones in your blood. This is the danger zone. She had a blood sugar of 600, which is not a normal blood sugar. It's usually about 120, 118 for somebody that has a normal blood sugar. Causes of diabetes ketoacidosis is illnesses. Illnesses are like, like a high amount of certain hormones like cortisol, which is stress hormones. What causes it? Heart attacks, alcohol and drug use. You want to check to prevent it. You want to check that you don't have, you want to check it. You want to check to make sure you don't have, to get this is by checking your blood sugar, make sure you're taking your medications prescribed, and you're talking to your doctor about how to adjust your insulin. What is the treatment for it? You get a little IV in your arm to make sure that you get your fluids. You need to give yourself some insulin to lower those blood sugar numbers. And you need to monitor your vital signs, your blood pressure, and your respiratory rate. Activity time. So let's get a whiteboard, guys, and we're gonna I want you to name at least 3 symptoms of diabetes ketoacidosis. Share it with your partner, okay? About 5 to 10 minutes will take, okay? All right, why people can manage type 1 diabetes is by insulin therapy, diet, exercise, diabetes education, frequent blood sugar monitoring to maintain a healthy weight. Now, here are the steps on how to check your blood sugar. So I will be passing out a glucose monitor, some test strips for you guys to check each other's blood sugar. So we're going to be doing that as one of the activities. We also have what the benefits of exercise is. Benefits of that is you're going to lower your A1C, decrease the rate of your heart disease, it lowers blood sugar levels, and it increases insulin sensitivity. All right, so you're going to be doing this with your partner. You're going to check the blood sugar, and you're going to share the blood sugar numbers with your partner. Now we'll have something on the board that will tell you which is a good range. And before you guys leave, get a ticket out the door. Tell me 2 things you have learned from this presentation. Okay, and that is all. These are all my references that I have included in this presentation. Okay, thank you guys.